Bastia, and he will be speaking on that. He doesn't need any person, we don't need doctors. No pills, no surgery, and no doctors for treatment. And let us listen to him on RMT.
Good morning everyone. I am really thankful and privileged to be here. The technology is changing the healthcare industry for last few decades. A new technology based therapies is coming every year. Today I am going to talk about a new technology based therapy. It's supposed to change the field of neuroscience in coming future. I am talking about RTMS therapy. This is repetitive transcranial magnetic stimulation therapy, a non-invasive brain stimulation in which the brain tissues are stimulated externally through a magnet, putting magnetic pulses. In this we'll discuss what is RTMS, how does it work, how safe it is, what are the uses with clinical evidence. It is an ideal therapy. Why? Because it is very effective. Numerous clinical trials already proven that. It is harmless because you don't have to take any medicine, chemicals, drugs, injections, no need of invasive procedure, surgery, anesthesia. So chance of side effect is very less. You can take no side effects. Simple to administer, simple OPD based procedure, come to hospital, take the therapy, go home immediately. This is how equipment looks like. This one you are using in our hospital. How it works? It works modulating and modifying the physiological function and structural activities of the brain. To understand this, you should know how the brain works. Brain is the most amazing and complicated structure the nature ever created. Just imagine a power station controlling the whole city. Now imagine thousands of such power stations compiled in one place and they are running continuously. So this is how the brain works. There is 86 billion neurons is connected to each other forming neurosynapses, and millions of them organized one part to make a neuronal circuit. Numerous neuronal circuits are there inside the brain, and they are communicating with each other by transfer of information in form of electrical impulses or electrochemical current. With that, there is continuous formation and degeneration of the neuronal synapses. Every day, new synapses are formed, old synapses degenerate. This is how the brain, different parts assigned for a specific function, communicate with each other. The mechanism is, it causes increased electrical activity inside the brain, leading to release of more and more neurotransmitters, and in long run it enhances formation of the neurosynapses, so producing a more medium to long term effect. This is how, with there is a normal stimulation and put impulses, the electrical activity increases, faster neurotransmission, release of more neurotransmitters. Formation of the newer synapses that potentiate the brain activity. When you give low frequency stimulation, it actually inhibit the brain. When you give high frequency stimulation, it causes facilitation of the brain. Look at a brain with depression. This is a normal brain. This is the brain of a depressed patient. When you give RTMS therapy, there is faster stimulation, enhancement of the neurosynaptic transmission, release of the neurotransmitters, increase in brain physiological activity, that leading to normalization of the underactive brain areas to normal physiological state. Who can take the therapy? Any human being under the sun who is breathing and has indication can take this. It is safe in pregnancy, safe for fetus, safe for children, safe for elderly population, safe for patients with renal, cardiac, respiratory or liver failure. But those having electromagnetic substances, metals, pacemakers, intracardiac lines, implants or medication pumps should not take it. Epilepsy is a relative contraindication. This is a patient in a hospital taking RTMS therapy. No systemic side effect. I am little over enthusiastic to saying that, but remember and believe, it has lesser side effect than the air you breathe in a polluted city like Delhi and Mumbai. The food you eat in a roadside restaurant, it is lesser side effect than that. Since it has some effect, there must be some side effect, commonly light headache, transient hearing loss, but they are very temporary, short lasting, goes away immediately without any medical intervention. Only a rare side effect, that is seizure. It is very rare, 1 in 1000 may get it, but especially if an epileptic patient takes this, it will happen. What are the uses? These are the conditions where it is used. Depression is the most common condition. There is meta-analysis saying that it is effective in depression. All type of depression, unipolar, bipolar, resistant, peripartum, post-TBI, post-stroke and depression. In OCD also it is effective. All these meta-analysis are supporting it. If you want to avoid anxiolytic, there is a choice for you. For de-addiction, it found to be effective. This meta-analysis way it is helpful in smoking de-addiction. You are a migraine who don't want to take analgesics, there is an option for you. Fibromyalgia, there is a additional treatment with RTMS. If you want to sleep without sleeping pills, there is an option for you. Chronic tinnitus, very difficult to treat, there is an option for you. It is also effective in Alzheimer's dementia, schizophrenia, reducing the negative symptoms and hallucination, in stroke rehabilitation, in Parkinson's disease. Different kind of tremors. It is effective in Parkinson's disease. A meta-analysis saying that it reduces the tremor, improves rigidity, and reduces the dopamine-induced dyskinesia. Maybe it is a safer and a cheaper alternative to DBS in future. In essential tremor also it is very effective. These are the recommended approval in 2008. FDA approved for depression, 2013 for migraine, 2017 for OCD, 2020 for smoking de-addiction, in 21 for anxiety disorder. These are the complete list of recommendation and protocols. So in conclusion, you can say it is a safe therapy, well tolerated. It is still in progress. More studies are required to explore in other neurological diseases, and it should be performed under guidance of a trained medical professional.